Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, free health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
As we're collecting the questions, we can go ahead and start with question and answer because I have some questions with me. The first one is for Dr. Padidar, and the question is, any preventive lifestyle to minimize stroke occurrence?
Well, that's a good question. How do you minimize your chances of having a stroke? Well, there are some things that you can control and some things that you can't. The things that you can't control is hereditary or genetic factors. Those you can't. But the things that you can, most of you know all of this, just to have a good life, nothing too excessive. So sleep right, eat well, don't eat too much fatty stuff, keep your blood pressure under control, smoking, keeping your cholesterol under control. And also an aspirin a day will keep your blood a little thin and also probably prevent some of these strokes as well.
An aspirin or a quarter aspirin, 81 milligrams?
Well, in the cardiology world, they use 81 milligrams. In the brain, 81 milligrams is not enough. You actually need a full aspirin, a 325 milligram tablets. Now, some people, their stomachs are a little sensitive. They can't take aspirin products, or they have to take it with, ulcer medicines. Ecotrin is not great. We don't recommend Ecotrin. Ecotrin is sold by the manufacturers as a way. But what it does, it prevents the aspirin from being absorbed appropriately. You're better off just to take an 81 milligram aspirin than an Ecotrin. Just regular aspirin. For the heart, they use baby aspirin. We use full aspirin.
What happens when I take aspirin and I bruise easily?
That's okay. That's the cost that you're going to get. That's the cost of being able to not have a stroke. So you have a little bruising, it's okay.
Okay, this question is for Dr. Nord. Why is there no artificial replacement for meniscus?
It's a very good question, a very, very forward-thinking question. I hope you can hear me. The truth is, there is, but it's in development. They're trying to create a collagen-based meniscus that could be implanted in patients that needed a total or near total meniscectomy, don't have any arthritis, but are having pain. There are relationships, as I mentioned before, that deal with the lack of meniscus and the progression of arthritis. So the goal in that sort of treatment is to eliminate pain and hopefully forestall the occurrence of arthritis. But this is something that's just in development. It's only available at a couple research centers at this point, and there are no long-term studies on it. What we do have some better studies on are that cadaveric meniscus transplant that I had one slide just showing so you could see what a meniscus looked like in real life. And those procedures are really for pain. There is no good evidence that shows that people can go back to high-level athletics after that sort of procedure. It's a big surgery, and it's not as good as having your own undamaged meniscus. But once again, in a young patient where their meniscus was already compromised and it's essentially all gone, and they're having pain, that can be a way to eliminate some of that pain and hopefully minimize their chances of getting degeneration in the joint.
Thank you. This next one is for Dr. Padidar. Is HDL as important as LDL? And there's a second part to this. how do I increase HDL to a healthy level?
Well, yes, they're both important. HDL is the good cholesterol, we call it. LDL is the bad cholesterol. And you want to keep both numbers in their target area. So the LDL in the stroke world, there is no low number. Again, we want that number to be as low as possible. And if you can, with exercise and eating right, you can bring up your HDL. But sometimes it's very difficult. I try to bring up my HDL and it's difficult. So that's where the genetic factors kick in. So they're both important numbers, similar to the blood pressure thing, the top number and the bottom number. They're both important.
Thank you. This one's for Dr. Nord. I'm 67-year-old and I'm a runner. Will running increase or decrease likelihood of a meniscus tear?
Well, what I would say here is that the big picture is what's important. And this also speaks to another point, which is that all 67-year-olds aren't the same. This patient clearly has a very active lifestyle and physiologically may be quite young, younger than 67. In terms of whether running increases the risk of meniscal tears, any activity you do theoretically would, but the benefits of running far outweigh the risks. You have cardiovascular benefits, you have muscular benefits, you're going to feel better, perhaps live longer. So we encourage activity, cardiovascular activity specifically. Now, within cardiovascular activity, we do tend to make an argument for lesser impact activity. So something like bicycling, either stationary or on the road, or swimming, or even elliptical machines in the gym, that has less impact on the joints than a running regimen would. If you are going to run, doing it on soft surfaces and making sure your shoes are appropriate and changed in a timely fashion is helpful to minimize the wear and tear on the joint. The evidence we have for that, it doesn't show any clear increase in arthritis in long-distance runners and no increase in meniscal tears, but you know, when you run, you put yourself at risk for twisting and impact. But once again, the benefits of running certainly outweigh the risks, so enjoy.
Thank you. Dr. Padidar, how do strokes affect short-term memory?
Well, if there
What was
is
the question?
You guys see Finding Nemo? Every 10 seconds she would forget. Well, short-term memory, there's areas of the brain that are involved in memory and short-term memory. And so if you do get, are unfortunate and get a stroke in that area, that's what's going to be affected. Most of the time, that's not the area because of the way the blood vessel supplies are. And that area is well protected. It has a dual supply. But it can in patients.
Thank you. Dr. Nord, when you have knee replacement, if you have knocked knees, do they make allowances? I think that, yeah, do they make allowances?
I'm not sure actually, is that what it says there? I'm not sure I understand the question.
Yes. When you have knee replacement, if you have knocked knees, do they make allowances?
Well, knock knees refers to someone who has what we call valgus, which is when your knees go in. When they say do they make allowances, I really honestly don't know what they're asking, but I will say that after knee replacement, they recommend against impact activity. So a 67-year-old with a knee replacement should not be running because that is a metal and plastic device and it has a certain amount of cycles and wear that it will tolerate, and that person should be doing lower impact activities. If they are going to do anything remotely high impact, it should be something like a doubles tennis. The recommendations vary doctor to doctor, but a lot of physicians would agree with that sort of statement.
It might make sense if I go to his next question. I guess this person has not had knee replacement. What he's saying, will knee perform like my original knees, and can I play sports? No,
a knee replacement does not function like an original knee. It's In fact, the real word in orthopedics is arthroplasty, not replacement, because there's no way to adequately and completely replace a joint and do justice to what it can do. A knee replacement is one of the most successful operations in all of surgery, any field, as are hip replacements. It's an excellent procedure in the right patient. But by no means does it give you a new knee like you had before you had any arthritis. Sports should be avoided if they involve any sort of impact or risk of trauma or injury, because fractures that you can get around a knee replacement are very difficult to manage and very, very troublesome. If you are very good at certain sports like skiing, there are some physicians that allow their patients to do skiing. Most physicians would allow their patients with knee replacement to do golf. And like I said, doubles tennis would be preferred over singles tennis.
Okay. Dr. Padidar, my blood pressure readings are, it looks like 125/50. Is this normal or cause for alarm? And how can I increase my diastolic above 50? Will iron supplements help?
Blood pressure is normal. You don't need to increase your diastolic pressure. Some people, you just, basically when your heart contracts and relaxes, the bottom number is the pressure when it relaxes. And so if as you get older and you develop atherosclerosis or plaque in it, you're going to get more stuff all around, and that's going to make the elasticity of the wall, like the hose in your garden hose, less. And so it becomes more of a lead rigid pipe. So that bottom number starts creeping up. So you don't want to, if you're doing fine and there's no symptoms you have, leave your blood pressure alone. Only if you're starting to see creeping up of your blood pressure, or you're starting to see symptoms like headaches or double vision and things like that, blurred vision, then you want to address it.
No, can I have a follow-up to that? That's my question. My friends are telling me to take iron supplements, so that would that help?
Iron supplements, I mean, if you have low red blood cell count,
No, because of the lower diastolic pressure.
All right.
Maybe.
Yeah. If you're not having any problems with your blood pressure, it's okay to have a low diastolic number. Iron supplements help to bring up your red blood cell counts. So you may be anemic, and that's why you're on iron.
So the fact that the reading is 50 does not necessarily mean
No.
that you are anemic?
No, the way to tell if you're anemic is to check your red blood cell count.
Okay.
Yeah.
Thank you,
Yeah.
sir.
This is for Dr. Nord. When you have knee pain and leg pain together, what is going on? Could you explain?
Well, there are a number of things that could go on. And when a patient walks into the office, there's probably 100 diagnoses that are running through our heads. And as we get more information, we refine and we get tests and we refine. And eventually we come up with what we believe is indeed the diagnosis for the patient. And leg technically means below the knee, between the knee and the ankle. What I'll say is that oftentimes knee pain can be referred down there. There could be blood clots in the calf. It could be a muscle strain. Any fracture obviously could cause pain throughout there. But a wide variety of conditions, including arthritis, could lead to that symptom presentation.
Thank you. Dr. Padidar, the slide said 140/90 as normal. I thought that 120/80 was normal, and after 1 year, can a stroke patient still improve?
Okay, so blood pressure is confusing. There is no magic target number. So the lower the better, if you can tolerate it. So if I was to take your blood pressures, and in some person, you take their blood pressure from 140 to 120, and if they have clogged arteries in their neck or carotid arteries or above, or if their heart is not pumping, and they go from 140 to 120, their brain doesn't perfuse as well. So they start getting dizzy and having stroke symptoms. And we increase their blood pressure because they're just not getting enough there. But in normal patients that have blood vessels that are wide open, a 140 and a 120. If you can tolerate a 120, that's great. So we try to keep the blood pressure up. Now, if your doctor places you on blood pressure medicine and you go from 140 to 120 and you start getting dizzy, especially when you get up, you're about to faint, well then your body cannot tolerate that. You either need to be having increased fluids or increase your blood pressure.
Thank you.
And the stroke, after 1 year, can you improve from a stroke? Stroke, when we have a stroke, the time, we set the clock to 0. So patients, I tell them, forget about how you were the day before the stroke. Basically, imagine yourself like a little toddler starting to do things from day 1 and set the clock as of this and look for improvement from there. And yes, usually strokes take a year, 2, 3 years for recovery.
Thank you. Dr. Nord, what causes arthritis and what can be done to minimize or eliminate arthritis?
Well, arthritis is by definition the loss of articular cartilage in a joint. So the shiny cartilage at the end of the chicken bone, when that is lost, either partially or completely, that's arthritis. What can be done about that? Once it occurs, there are a number of things. One is symptom management. It's very hard to regrow cartilage, and in the setting of arthritis, it really is not a successful effort. If a youngster has a chunk of that cartilage taken out and the rest of the joint is normal, then that's a setting where we can try fairly advanced efforts to regrow cartilage in that divot that is left. Arthritis is a different ball of wax. That's a more diffuse process, and what we try to do is make the patient feel better. Oftentimes anti-inflammatory pills work. If there's only one side of the knee that involves arthritis, sometimes we give the patient a brace to shift the weight to the other side of the knee. Sometimes we do knee replacements, either complete or partial. Sometimes I just had a patient who was having symptoms of overloading and arthritic change on one side of the knee, and she was actually a good candidate to have an osteotomy of her tibia. And we cut her tibia and realigned it so that the forces now went on the outside part of the knee that was healthy, and she feels much better as a result. A bunch of things can be done.
Thank you, Dr. Nord. Dr. Padidar, how do we control triglycerides, and what is the maximum level of triglycerides?
Well, I guess if you have a genetic problem, the maximum level can be off the charts. But again, triglycerides, there is no low number. The lower, the better. There are medications that can control triglycerides, and they're usually given in conjunction with your statins that are usually used for lowering your LDL. So if you, after taking your statins, your triglycerides are still high, your doctor may add a second medication. Also, what is good is taking the vitamin E, the fish oil. The fish oils, and there is some, be careful when you buy these fish oils because some of them have cyanide in them, contamination, so go to a reputable place to get them. But fish oils have been shown, and you don't have to get the ones that are advertised on TV. You can get them from Walgreens, and they're much cheaper, and they really do well. They just may taste a little funny, but they really help with the triglycerides.
With the flaxseed oil or soil, what's the difference? Fish oil, flaxseed oil?
Oh, well, they're both oils, but there is some apparent help with flaxseed oil. There's a lot of oils that are newer, that like grapeseed oil and so forth, that are considered to be better for you than using the lard that we used to use. So this is just a new generation of oil. But that fish oil in itself has been shown to decrease your triglyceride.
Can we take both?
Yeah? I mean, a lot of people cook with flaxseed or put it in their salad dressing. So, whereas the fish oil are taken as a food supplement.
I see.
What type of fish should we be aiming at as far as oil?
Well, all fishes have it, but you know the problem is if you to get the amounts that you need to eat a lot of fish, and yeah, eating a lot of fish sometimes is a problem because of lead issues and stuff. So the amounts that are needed, if you have such a high triglyceride, you can only get from eating the supplements. You'd have to be eating fish 5 times a day. But all fish are good and have it in general.
Dr. Nord, is there such a new procedure of laser treatment for meniscus tear?
Not that I'm familiar with. I have not heard of any laser treatment for meniscus tears. What I will say about laser treatment is that there are certain good indications for lasers, especially in other disciplines of medicine. I know it's used in neurology, it's used in dermatology. I've seen some laser uses within orthopedics that have not really been scientifically based, and they've fallen out of favor over the years. While laser is an interesting technology, we have to make sure that its uses are evidence-based and appropriate. But for the meniscus, I really am not aware of anything.
And this goes along with that question, healing time for surgery after a meniscus tear?
It depends on what type of surgery it is. I'll go through 2 categories. One will be a partial meniscectomy and one will be a meniscal repair. For partial meniscectomy, there's nothing that we need to protect. All that we have to do is make sure the patients are comfortable. So what we do is we give the patients crutches initially, just so that they can be kind to their knee that just had surgery for a few days. But they're allowed to walk on it if they wish. There's no reason not to. Those patients rehab aggressively, get motion aggressively. We're tough on them because there's no repair that needs to be protected. Those patients typically feel better within a couple weeks after surgery than they did immediately after the procedure, but continue to improve for months afterwards. But many patients in that setting are happy within a couple weeks to a month after, and they continually get gains. A meniscal repair we move much more slowly on. We keep patients on crutches sometimes up to 6 weeks because we want that meniscus to heal without being forced apart with the weight bearing. Because of that, that slows down the rehabilitation. Sometimes we even limit the amount they're permitted to bend their knee for the first 6 weeks, and they recover more slowly. It can be up to 4 months after a meniscal repair before you're allowed to go back to high-level contact athletics. But if that 4 months is the difference between having a complete meniscectomy versus having a repaired meniscus, it's a good investment for the patient to make.
Thank you. One last question. We have to get started with our health fair. And this is for Dr. Padidar. A patient was asking if fish oil increases the risk of strokes.
I haven't heard of that. Fish oil decreases your triglycerides, and triglyceride, decreasing that is a protective thing. So I would say it benefits and has a protective mechanism.
Well, let's thank Dr. Padidar and Dr. Nord.